Hi everyone, I am Dr.Soumya, consultant physician working in Maulana Hospital, Perindalmanna. Today we will be discussing about a topic called Nipah virus. So, why this is important is 2 days before a boy of 12-year-old died of Nipah virus infection in Kerala in Kozhikode district. So, this is not the first time Nipah virus infection is seen in Kerala. It is the third time Nipah virus infection is seen in Kerala. So the first episode of Nipah virus infection was in 2018. Then there were few cases in 2019, and this is the third time in 2021. So let's discuss Nipah virus. So what is Nipah virus? It is a viral infection basically belonging to Paramyxoviridae family to the genus Nipah virus. So, like coronavirus, the Nipah virus is also a RNA virus. Now, let's see what are the symptoms, the incubation period, the mode of transmission, the diagnosis and treatment of Nipah virus infection. Basically, a person who is affected with Nipah virus will start showing symptoms within 4 to 14 days of infection. This is the normal incubation period of Nipah virus. In some individuals, it may extend from 14 days to 21 days, and cases have been reported till 45 days of infection of Nipah virus. So, what are the symptoms of Nipah virus? Nipah virus will present as any either viral infection. The basic symptoms includes fever. The patient may experience throat pain. He can have cough. He can have headache, myalgia, excessive fatigue, and sometimes the people may have vomiting and abdominal pain. So these are basically the early symptoms of Nipah virus infection. Unlike coronavirus, Nipah virus is very rare to present as asymptomatic. So usually it's easy to diagnose Nipah virus than coronavirus. Coming to the route of transmission of Nipah virus, initially the Nipah virus was identified in Malaysia. At that time, it was seen transmitted from pigs, and this is a zoonotic infection. A zoonotic infection is nothing but an infection which is transmitted from animals to human beings. So here also Nipah virus infection has been transmitted from animals to human. So that is one of the route of transmission. Where normally, as I mentioned before, it is the pigs, and another host of Nipah virus is bats. Now, how the infection gets into human being? So it is fruit-eating bats which harvest the Nipah virus. So when these bats eat the fruits, the virus in the saliva of the bat will get deposited inside the fruit, and they will replicate in the fruit. So if a human being eat the fruit, the same fruit which was infected with Nipah virus, which was eaten by the bat, this virus will be transmitted to the human being. This is the one of the transmission mode of Nipah virus. The next transmission is from human to human transmission. That is, a person who is infected with Nipah virus can transmit the virus to other individuals. So this happens through secretions like blood, saliva, air droplets, CSF, that is cerebrospinal fluid, and even the urine and feces. So any body secretion, if another individual is coming in contact with the body secretion of the patient who is infected with Nipah virus, the other individual is susceptible to get that viral infection. So this is how human to human transmission occurs. Now, what are the complications of Nipah virus? Once infected with Nipah virus, as I mentioned before, 4 to 14 days you will have a few set of diagnosing symptoms. Once at this level the treatment is not properly taken, or if it was left undiagnosed, Nipah virus can lead to complications. Out of the complications, 4 are the main complications of Nipah virus. First, it can present as pneumonia, just like coronavirus. So it can affect the lung and it can produce consolidation patches in the lung, and then it can lead to breathlessness, acute respiratory distress, and even death of the patient. Another common complication of Nipah virus is meningoencephalitis. So this meningoencephalitis is nothing but the Nipah virus, after entering the bloodstream, can infect the meninges, which is a covering of our human brain. So the inflammation of meninges and brain causes meningoencephalitis. In this stage of infection, the patient will have these following symptoms. The symptoms of meningoencephalitis caused due to Nipah virus are: a patient can present you with severe headache, he can have drowsiness, he can have seizures, epileptic symptoms, and the patient may also present you in coma stage. So this is one of the grievous stage of Nipah virus infection, and the patient may succumb to the disease. Another commonest mode of in this severity of Nipah virus is septicemia. Septicemia is nothing but any viral infection or any infection, once the virus enters or bacteria enters the human body, it replicates itself, and it may affect one or two organs, and later the virus or bacteria can disseminate through the blood. So when the virus or bacteria enters the blood, it can infect any of the sites of human body. So this is the stage called septicemia, where the virus or the bacteria will be present in the blood. So in Nipah virus, the viral particles can be disseminated through the blood. This is the stage of septicemia. In this stage, the patient can go for decreased BP and heart rate abnormalities, and the patient may succumb to the disease. And another rarest complication of Nipah virus is when the Nipah virus affects the cardiac muscles or the heart muscles. When the heart muscles get inflamed, the patient can have symptoms in the form of chest pain. He can have decreased or variation in the heartbeat, and rarely they can present with myocardial infarction or heart attack. So these are the complications of Nipah virus. But when the Nipah virus is early diagnosed and managed properly, it is unlikely to develop these complications. So what is the difference of infective rate and the prognosis rate of Nipah virus from coronavirus? COVID has replication rate is more and infectivity rate is more, but the morbidity is less. But coming to Nipah virus, this viral replication rate and infectivity rate is low, but the mortality rate is more in Nipah virus infection. Now, how to diagnose a Nipah virus disease? So, as all of you are familiar, the RT-PCR, which is the test used for coronavirus, the same RT-PCR test is used for diagnosing Nipah virus. In the RT-PCR, we detect the Nipah virus antigen in secretions like saliva, blood, urine, or CSF. And another test which is present for Nipah virus infection is antibody detection. So you can get antibodies against the Nipah virus antigen in the blood. With this can be tested using ELISA. So these are the two common modes of testing of Nipah virus. Even the RT-PCR test can be done in the throat swab or nasal swab like COVID infection. Now coming to treatment of Nipah virus. So as like COVID virus, the Nipah virus also doesn't have a single therapy or single treatment. The treatment or the management is based on the organ affected and the symptoms of the patient. So usually it is a symptomatic management and supportive care which is used as the treatment modality of Nipah virus. So as always, prevention is better than cure, but unfortunately till present date we don't have effective vaccine against Nipah virus. So we have to take precaution not to get infected with Nipah virus. Now how can we stay away from Nipah virus, or what are the precautions which can be taken from our side for not getting infected with Nipah virus? One thing is, if don't visit areas which are more prone for visiting by bats, and don't eat fruits without washing, and if you suspect a bat has bitten any fruit, better discard the fruit and don't eat it. So this is how you can prevent getting infected from bad saliva. And coming to human transmission, it is same as the coronavirus precaution. That is, you have to maintain either at least 1 meter of social distancing from the patient who is infected with Nipah virus. And in order to prevent the transmission through air droplets, it's always better to use a two-layered mask, or it's N95 mask. So proper precautions to prevent the droplet infection. And again, as the bread and butter of coronavirus prevention, always wash your hands with soap and water, or disinfect the hand using sanitizer. So these are the methods for prevention of Nipah virus disease. So early, as like all other fever, early detection, proper management and proper treatment can avoid the complications of Nipah virus. And if detected early and managed properly, it's easy to cure the disease of Nipah virus. Thank you.